SARMs for bodybuilding, what are they? Are they safe? Developed in 1998, SARMs or Selective Androgen Receptor Modulators are a novel class of androgen receptor ligands. These are intended to have the same effects as anabolic steroids but are often marketed as a legal substitute. The big red flag according to a new study published in JAMA 2017, many products containing or marketed as SARMs that you can find online actually contain unapproved substances, hormones and steroids. Not only do they contain banned substances, but the labels stuck onto the side of the bottles are often completely made up. Upon testing, it was found that 59% of 44 different SARMs products actually contained the amount of each substance that was quoted on the bottle. We're not talking out by a couple of milligrams, but out by a factor of 10 plus in some ingredients. Within the research, it was also found that 39% of the supplements tested contained unapproved drugs and 25% contained similar substances that weren't even included on the label. What I'm getting at here is that SARMs are some seriously sketchy shit. FDA approval. Despite what you may have heard elsewhere, the compounds found within the analysis haven't actually been approved by the FDA, so the pharmaceutical companies that have been developing the questionable compounds cannot actually sell these products, just as much as a physician cannot prescribe these drugs to patients. Due to the lack of testing, lies about what is actually contained within the products, and a huge question mark over the legitimacy as a whole, there is very little information about the safety and efficacy of SARMs. Some compounds found in the products tested have never actually been tested on humans before. This prompted a warning from the FDA in October 2017 stating that life-threatening reactions, including liver toxicity, have occurred in people taking products containing SARMs, and that SARMs also have the potential to increase the risk of heart attack and stroke, and the long-term effects on the body are unknown. Side effects of SARMs. Although there hasn't been any thorough clinical testing on humans as to the effects on SARMs, through human trial from bodybuilders and fitness enthusiasts, there has been some feedback on what has been experienced with the use of the supplement. These include depression and suicidal thoughts. Those taking the sketchy supplements have noted a worsening or introduction into depression and more frequent suicidal thoughts. This isn't unique to SARMs and is one of the main side effects of anabolic steroids and other performance-enhancing drugs. Partial blindness and blurred vision is up there with one of the worst side effects from SARMs and steroids. The internet's got hold of this one, and it's blown up in a way we didn't expect, from videos explaining complete loss of vision to posts on forums with users explaining fear for their vision. Some users of Ostarine have reported the issue, and following tapering off of or complete quitting of the supplement has restored vision back to normal, thankfully. Virilization. Female users of SARMs need to be just as, if not more careful than men with the development of masculine features, with the reduction in the femininity of the user. Virilization is up there for women as one of the worst side effects coming from large doses of SARMs and the consumption of the unknown substances that could be in the supplement. Gynecomastia. Gyno is another of the side effects that's shared with both SARMs and steroids, and it's one that no one wants, with the estrogen balance being affected with the consumption of these supplements. If you value your nipples, you might want to steer clear a little. Suppression of natural testosterone. The suppression of natural testosterone is another side effect that we were expecting, but it's not one that we're particularly keen on from a supplement. Some SARMs products have a similar effect to the testosterone production that Winstrol does due to the high anabolic effect seen. SARMSS23 has been noted as particularly bad for this, and with the track record of the others produced, would you really put it past companies to include the same ingredients? Post-cycle therapy is sometimes recommended from coming off SARMs, so it's a good idea to get medical advice. Baldness. Amazingly, this is the side effect that's gonna stop so many of us from partaking in performance enhancers, and you can expect baldness not only from steroids, but from SARMs too. Although it is expected that SARMs are safer in this respect than the use of steroids, it's difficult to say what's in them. What's the verdict? If you haven't guessed by now, we're taking a very simple approach when it comes to our recommendations when it comes to SARMs. At the current time, with such a lack of research, an FDA ban and the uncertain measurements of banned and unlisted ingredients, we're saying that you should 100% stay away from the supplement at this time. That's not to say that SARMs will always be bad and that there never will be a time that they will have a place in the supplement section in our kitchen, but for the time being there's too much uncertainty for what you're getting. The future of SARMs, we're expecting in the future that if, and it's a big if, SARMs continue in the market, that they will have to be regulated in a way that is much better than they are currently. We want to see truthful labels and extensive research on what makes up the supplements, and we want to see FDA approval on each and every part of them. But to be honest, this is just heading down the path of them becoming an actual steroid, so we can't see them taking off anytime soon.